A 64-year-old woman with a history of diabetes, hypertension and congestive heart failure was brought to the emergency department after she complained of headache and blurred vision and was found to have a blood pressure of 220/95 mmHg. The intern who saw her wanted to treat her with the drug X, but the attending physician rejected this choice because of its tendency to cause a compensatory tachycardia and exacerbated fluid retention, as well as its potential to cause lupus-like syndrome with a long-term use. Which of the mechanism of action of the drug X? So number first, the patient is suffering from diabetes and the patient is suffering from hypertension. They didn't say that the hypertension is because of the due to diabetes, or it may be essential hypertension, or they didn't say the cause. It may be both sometime. Okay, it may be because of the essential idiopathic, or it may be due to the diabetes. And congestive heart failure, it may be due to the result of the hypertension and diabetes mellitus here and brought to the department. So now the patient is feeling headache and the blurred vision, and there is a severe hypertension. The physician decided to give her a drug, okay, X. If we think about the drugs which are used mostly in case of diabetes mellitus, that is, we can use in case of diabetes anti-diabetic medications, and then we can also use regular insulin in order to treat the patient with diabetic mellitus. And hypertension, in case of hypertension we can use the medications, anti-hypertensive drugs. For example, we can use in ACE inhibitors, we can use some beta blockers, we can use diuretics in order to decrease the fluid retention. If there is congestive heart failure, we can use medications which increase the contractility of the heart. We can use depending upon the type of the congestive heart failure, that the cause of the congestive heart failure, we choose medication. But most commonly the medications which use in these conditions, they are ACE inhibitors, they are the diuretics, they are the vasodilators, they are the venodilators, or those medications which act on both veins and arteries, and they cause the dilation of the both. And some medications like ACE inhibitors, yeah, or we can use some angiotensin receptor blockers. So all these drugs are very benefit for the patient which having cardiac problems and hypertensive problems. So in this condition, if we think about all those drugs, okay, and compare all those drugs and think that which drug cause a reflex tachycardia, or they causes fluid retention, or they cause this lupus-like syndrome. So there are few drugs which causes lupus-like syndrome when they use for the long period of time. One of the drug among the medications used in hypertension, that is the hydralazine. Okay, if you use the hydralazine for a long period of time, it causes lupus-like syndrome, and it also causes the compensatory tachycardia. Why it causes the compensatory tachycardia? Because for example, this is our blood vessel, okay, mainly because the action of hydralazine is mainly on the arterial system. It has very less effect on the venous system, venous circulation, okay, veins. So this is, I will make a hair here, okay, for example, this is your heart, and it is ejecting the blood. When we use hydralazine causes the dilation of these vessels. When the vessel dilated, okay, the blood pressure, the peripheral blood pressure reduced, the resistance or the peripheral resistance reduced, or we can say that the afterload on the heart reduced. This means it is dilated. So the neurons, they sense that the blood in the vessel is low, there is very less or less volume into the blood. As the vessel dilate, it senses that now the volume is less, because there, and when these vessels go away little bit, they feel less pressure on the wall. When they feel less pressure, they send message to our central nervous system, okay, and in response to this, there come the message to heart, okay, and this increases the heart rate. It increases the contractility, it increases the heart rate, so it causes tachycardia, and it is a reflex tachycardia, or we can say compensatory tachycardia. So it causes fluid retention, and it also causes the reflex tachycardia, and it is only the drug among the medications used in hypertensive cases which causes the lupus-like syndrome. So what is the mechanism of the hydralazine? The hydralazine causes increases in the concentration of cyclic GMP, and this cyclic GMP, okay, through a series of reaction and process, okay, it increases the blood vessel diameter, it causes the vasodilation. So we can say that this is a drug, only drug is given to the patient, decided to give to the patient in order to decrease the blood pressure, but the physician, okay, the other physician stop that. They say that this drug is not very useful because it causes the lupus-like syndrome, because it causes compensatory tachycardia. So in medication, in our medicine, hydralazine is used in a very severe case of hypertension or very high essential hypertension. Those cases, in emergency situations, we use the hydralazine, and hydralazine is not mostly used for a long period of time. So let's go through the answers. So number first, that is the block calcium channel. No, hydralazine, the action of hydralazine is not blocking the calcium channel, so this is a wrong option. Second, decrease the production of cyclic AMP. As I said, it increases the cyclic AMP production, so it is also wrong. Increase the production of cyclic AMP. Yes, this is the answer, that it increases the cyclic GMP. Other option, that is inhibit the angiotensin converting. No, it is the action of angiotensin converting enzyme inhibitor medications, okay. And increase carbonic acid, it is not the action, it is the action of acetazolamide. And increase sodium chloride reabsorption. No, this is also not. That sodium absorption is mostly done by some medications that is used in case of fluid retention, okay. So thank you.